this statement, I'd like to talk about steps 4 and 5 for how we can create a healthy economy in the state of Illinois in which everyone will have an opportunity to be employed at living wage jobs or better. In steps 4 and 5, I'm going to be talking about investing in people as the best way to reach economic health by talking about first education and secondly health care. So the fourth step for achieving a full employment economy in Illinois is to improve education and provide free higher education for all Illinois residents who qualify academically. Once we solve our budget problem, a top priority must be to invest in people, and above all in education. We not only need to improve the caliber of grade school education from pre-K through high school, we also need to make a massive investment in higher education, making either college education or vocational education tuition-free for all in-state residents who maintain the required academic standards. To those who say we can't afford it, my answer is that we cannot afford not to. Investing in free higher education is one of the smartest expenditures a government can make, and it is one of the most effective ways of stimulating our economy. Making higher education tuition-free will do the following. It will reduce the oversupply of labor in the labor market. It will create more jobs in education directly at state colleges and universities already well distributed throughout the state. It will create more construction and spillover jobs. It will eliminate all or most student debt, thereby putting more purchasing power in the hands of students and graduates to spend on goods and services, not enriching banks. It will eliminate the impact of tuition on parents, thereby putting more purchasing power in their hands. It will eliminate the stress and time expended on struggling to finance higher education and eliminate the bureaucratic waste expended on the cumbersome financial aid process, freeing up more resources for education itself. It will improve productivity for existing businesses and attract new business to Illinois for the right reasons, and it will increase new business generation in Illinois, thereby creating new job opportunities. I would point out that in 2005, the National Association of Manufacturers issued a report in which they pointed out that one of the reasons why manufacturing jobs in the United States and Illinois are going overseas is because the lack of a sufficiently skilled workforce. Investing in education will be a way of attracting business here for the right reasons. The original GI Bill of 1944, which provided our World War II veterans with free higher education, helped pave the way for the sustained economic boom of the 1950s and 60s. For every dollar spent, the government was eventually repaid 7 times over. We can help create a renaissance here in Illinois if we learn and apply this valuable lesson from our recent history. A number of countries around the world, including some lesser developed countries, provide higher education to their citizens either free or at nominal cost. There is no reason why we cannot do it here in the richest nation in the world. Of course, apart from its economic impact, higher education is a good in and of itself, leading to a society that is better equipped to deal with today's complex social and political problems. A more detailed policy statement on our education policy may be found elsewhere on my website. Turning now then to step 5 and how we can create a full employment economy, a healthy economy here in Illinois. Step 5 is we need to implement single-payer health care in Illinois. The overall case for a single-payer, improved Medicare for All health care system is presented elsewhere in greater detail on my website. The main rationale for adopting a single-payer health care system is that it is the only way to ensure that every Illinoisan will have access to the health care that they need. Health care should be seen and must be fought for as a right. But single-payer health care will also be of economic benefit as well. It will, among other things, attract business to Illinois. One reason why auto and other manufacturing operations were moved from the United States to other countries, including Canada, is due to the high cost of health insurance under our privatized system. Although a single-payer system would require a payroll tax similar to that already levied for Medicare, this will be a lower and more stable and predictable cost than the skyrocketing costs imposed for private, for-profit health insurance. Most businesses will find single-payer to be a much more affordable option and will have a good incentive, a positive incentive, to come to Illinois. Another effect of single-payer health care is that it will save working families money and eliminate many bankruptcies. Again, although no healthcare system is free, a single-payer system would impose lower costs on working families overall than the soaring costs imposed by private insurers. The cost savings means more discretionary income for working families, creating economic stimulus. Meanwhile, healthcare debts are a major cause of about 60% of all personal bankruptcies in the United States. A single-payer system would dramatically reduce the rate of bankruptcies. Another impact of a single-payer healthcare system is improved workplace productivity. The lack of affordable healthcare means that workers without adequate insurance often forego treatment, which in turn means more illnesses of longer duration spread to more coworkers. This costs U.S. businesses the loss of 64.7 million avoidable sick days every year. Stated differently, healthier workers are more productive workers, which means improved personal as well as economic health and as well as physical well-being. These are among the reasons why I support the Illinois single-payer bill, House Bill 311. We can have single-payer here in the state of Illinois, even though it looks like it is apparently not going to happen nationally. We can lead the charge. We can get ahead of the curve here in Illinois by fighting for single-payer, and as your governor, I will lead an uncompromising fight for a single-payer healthcare system in our state. I'm Rich Whitney, Green Party candidate for governor of Illinois. I thank you for listening, and I would appreciate your support and your vote in November 2010. Thank you.